Thank you for joining us. This is Mature Living. I'm Mary Yanez, Director of the Senior Adult Program at the El Paso Community College, and we are going to talk about open enrollment. I never get tired of talking to people, trying to understand what open enrollment means when you think about Medicare. And so we've invited Rosendo Martinez Jr., who is with WellMed Group, Health Group.
Yes,
and you're the Associate Growth Officer. And,
yes,
you know, I've known you for so many years, Rosendo, and it's good to have you in El Paso.
Thank you for inviting me out.
Great. And so you're come to talk to us about WellMed, and tell us about why it's so important for us to talk about WellMed and what you all do.
Thank you, Mary. So WellMed is a group of clinics and physicians that specialize in taking care of older adults that have Medicare. So we've been in business now for over 26 years. We were started in San Antonio, Texas by a physician who saw a void in the care for older adults. He saw the way his parents were being taken care of, and he wanted to come up with a better system. So our vision is to help the sick become well at a lifelong effort at wellness. And then our mission is to help change the face of healthcare delivery for seniors with a proactive approach to healthcare, which is really different. I've learned, and I don't know about you, Mary, but I practice reactive healthcare. I wait until I'm good and sick to go to the doctor, right? And at WellMed, we don't do that. As soon as we know that we have somebody that's a new patient, we proactively reach out to them, call them, schedule an appointment to bring them in, and start looking at what's going on with you right now. Where are you at now, doing all your lab work, a physical, checking all your medication, and trying to put together a proactive approach. We're not going to wait for our patients to get sick. We're going to try to, if they're sick, get them healthier. If they're healthy, keep them healthy. So it's a very unique approach.
You know, I drive around town and I see all these WellMed facilities, clinics, I don't know what you call them, but
clinics, yeah.
And the cars are out there, people are coming in and out. How does that work? Because I know you probably have many throughout the state. Since
you know, we did start in San Antonio, but here in El Paso we have 8 WellMed facilities that we own and operate. So you're going to see WellMed on the outside of the building. But we also work with 16 other doctors around the El Paso County area that when it comes to older adult care or senior care, they practice the same model that WellMed does. So we actually work with those doctors to kind of teach them the way we take care of people, and they implement that with their senior care portion of their clinic. So I think we have locations spread out from the west side, the northeast, central, east side, lower valley. We just finished renovating our location on Yarborough, brand new facility that is just getting ready to grand open. And our location on Traywood in Western Brent is the biggest WellMed facility in our company.
And people can come and get a tour.
Absolutely.
You know, I'm sure you welcome, you know, just walk-ins just to see what it's all about.
Yes, so we do work with 5 different Medicare Advantage plans here in El Paso. So we accept Medicare or one of those 5 Medicare Advantage plans. So if you have that, we definitely welcome you. Like to welcome you to come take a tour. I think you'll find when you come into one of our locations that it's probably very different than what you may be used to. Big leather couches, flat screen TVs, coffee bars.
It sounds like a good place to visit.
They're very nice facilities.
The environment is
very
nice.
Yes, ma'am.
Now, it's important to talk about this because it's enrollment time. Tell me about why we're really wanting to reach out to the seniors and to think about the plan that they have, and maybe there might be a change.
It's really important, Mary. You know, the Medicare open enrollment season only comes along once a year.
Okay.
So it starts October the 15th and it ends on December the 7th. So we're 3 weeks into it right now. It's an opportunity for everybody that has Medicare to take a look at what you have now and decide is that what's best for you for next year. Because whatever you decide now is going to start on January the 1st. So you can have, your options are to have Medicare by itself along with a prescription drug plan, which some people do that. You can get a Medicare supplement that can help you. Or there are these things called Medicare Advantage plans that like we work closely with. But I think the thing to do is take a look at what are the medications that you take?
Okay.
Who are your physicians that you work with? And when you take a look at the different options that are out there, you want to be sure that those plans work with the doctors that you use, that the formulary has the medications that you take. So you got to take a look at all that. And an easy way to do it is to work with a licensed insurance agent who could answer, all of your questions about your options, your choices.
And when you all talk to a senior that comes to you and says, I want to find out if WellMed is the right thing for me, you go through it, all the plans, you ask them questions. How do you do that, your agents?
We would actually work with a licensed agent to do that.
Yes.
So we don't actually have the agents on our staff, but we do know a lot of people in the El Paso area that could help them. Talk about one of the 5 options, 5 plans that we accept. And so whatever they do now would take effect usually in January. Now, there's some people that qualify for additional assistance like Medicaid. So if you have Medicare and Medicaid, you can actually enroll into a plan or change your plan anytime during a year. It's up to you. I don't think it's a good idea. I don't recommend it because anytime you change plans, you're changing the network of providers. You're changing the formulary for your medications. And you have to be careful with the continuity of care.
Yes, and so it isn't just a snap. It's something that has to be thought out, and it's so complicated. For me, and you can explain. And we talked about if it's difficult for us, you can imagine how difficult it is for a person, an elder couple, or somebody that's trying to figure it all out.
Exactly. I mean, I don't think they do anything easy. Whenever Medicare mails you something, it's there's just a lot of reading. It's confusing, and that's one conversation I have with the insurance brokers out there is you got to really take your time. A good explanation, you're going to spend an hour and a half to 2 hours with somebody to really explain everything and answer all their questions and be sure they're comfortable with the decision that they're making.
Because it is their choice. It's everyone's choice to find the right fit for their health care, for the providers, for their doctors or medications. And so it's great that you come and we try to explain to everybody that it's doable. It's doable. Well, we want to thank you for coming by and explaining all this to us. And I know you're based in San Antonio in headquarters, for WellMed. And it's good to see you again,
Good to see you, Mary. It's my pleasure. Thank you for inviting me out.
And WellMed has been a great community partner for our senior adult program at the college and serving this community.
Thank you, Mary. Appreciate it.
Okay, we'll be back with more guests. As you know, we bring you great information, new information on what's going on in El Paso. Because this is a community program for seniors, we want to tell you about a new initiative that's being formed right now. It's with the Department of Transportation, it's UTEP, it's the City Parks and Recreation, and many other partners that are going to be knocking on your door because they need your help. Thank you for joining us. This is Dr. Gina Núñez from UTEP. Good to see you again.
Thank you, Mary. It's nice to be on your show.
You're an associate professor over there at UTEP. You love those students, don't you?
I love my students.
Yes,
this is
and
my
now you're going to love
year.
seniors.
I love my seniors, yes.
And of course, David Lopez is with the City Parks and Rec, and you're a regular here.
Thank you very much for your
I'm
invitation.
glad you're partnering with Dr. Núñez. Tell me a little bit about why you're here and what you want to announce.
Well, Mary, I'm really pleased that UTEP has a partnership with City Parks and Recreation. Mr. David Lopez and many members working in the city are UTEP alumni. So every time we have an opportunity to partner with our alumni, but more importantly, to be engaged with our city, we're very proud that if we can create professionals together then the students that are graduating from UTEP have a sensitivity and a commitment to their community, right? So a lot of the needs arise in the community. And so seniors have a lot of needs with transportation. And very recently, I was asked by one of my colleagues in computer science if I would join a partnership, a research project that was funded by the Department of Transportation. So we have colleagues in engineering, Dr. Kelvin Shu, and then Dr. Natalia Villanueva in computer science. So they said, we're trying to develop an application on a smartphone so that it could work with seniors, so they can find information available at their hands, so they can find the best resources on how to move around the city. So it's oftentimes referred to like a smart city initiative. And so I want people to know that the other city doing this is New York City and El Paso. Right?
I love that.
Isn't that amazing?
I'm in. Senior adult programs in our students that are learning the smartphones. We have free classes. We're going to work on this. We're going to make it happen for El Paso.
Absolutely. Sometimes there's resources in the community, but if we don't know they exist, then people can't use them.
Yes.
So I think this is a marvelous opportunity for us to come together and connect our different audiences, our different needs, and our different talents.
Yes.
So we have folks in engineering developing smart cities and transportation networks, people in computer science using how to use computers. And then we have the partnership with the city and our seniors through the senior games, through the senior centers.
And you mentioned that human connection. You know, seniors love to see you face to face. They may be not too computer savvy, but they need to know about this as well, right?
Absolutely.
Yes.
And that's where David comes in. And
Well,
his
the new technology is very important also because we can connect the generations. You know, seniors love to connect with the families. Now with this application, they'll make it more easy because, as you already know, you can even videotape your conversation with them, you know. So it's very, very important so we can connect. So this is intergenerational. And not only the seniors can benefit, but also all the young generation, the families and the grandkids and all that. So this is an initiative that we're really looking into it, the new era of technology.
And how many senior centers are going to be involved in this? You mentioned
As we already know, you know, Parks and Recreation has 11 senior centers all over the city with more 1,500 to 2,000 seniors on a daily basis. So, and we want to expand that, you know. So there's some people that cannot come to the centers. So that's why we want to reach out to them, especially for your program, that we really appreciate your collaboration and also your collaboration that presence in our senior centers.
And I expect our viewers, right now I'm saying you respond because we're going to give you a number at the end of the interview here to call if you're interested. Now let's see, what are we asking for? We need to do a survey or some sort
We're
of
doing a survey and we have them in Spanish and English. It's all confidential. You never have to sign your name. You just say, yes, I give you my permission to interview me, and we put the date. So for every survey, we have a consent where you know what we're asking you. We're not asking you about your income. We're not asking you about Social Security. We're asking, how do you move around? How often do you walk, or do you use the bus, or what other services do you use? And, you know, if you have a phone, do you have a flip phone, a home phone, a smartphone? And so I bring out my phone as a prop, right? This is a smartphone, and it's like a computer in your hands. And so if you give us information, we're going to collect all your stories, all your information. We're going to give them back to the scientists, the computer scientists.
I love that the UTEP students are working
on
on
this.
this.
UTEP students are working on this app for our seniors now.
Wow.
And I'm very proud of our team because they chose seniors. They could have chosen any other population, but they said, no, let's design something for seniors. And for me, this is the relationship we've had with David over the years to address the needs of our seniors and find out what their needs are. So I'm really pleased that we can partner with the senior centers, but I'm also reaching out to you all out there. If you don't know about the senior centers, please let us know so we can get that information about your nearby senior center and how to get there. But there's also people who don't know how to drive or are afraid of falling and are by themselves at home. So we would like to figure out how to get the survey in your hands so that you can tell us what your mobility needs are. How do you want to move around?
Do you have to ask for a ride? Do you catch a taxi? Do you use Amistad buses to go to the doctor?
LULAC buses,
Yes.
Amistad buses, or do you use a Uber? You know, some people say, I
I
can't
just
wait.
barely started. I got an app for Uber
Yeah,
now.
maybe sometimes our seniors wait for their kids or their grandkids, but they're working or they move away.
Exactly.
So that's no reason to stay home all the time. If you need to go pick up your medicine at the pharmacy or pick up some groceries, now you can call and they can pick you up. It's at a cost, but also you can get a reduced price bus pass. And if you can get a bus pass, you can have mobility around the city.
Absolutely.
We just
I
need to
think
know how to connect our services with our senior needs.
very good.
That's
and,
the goal of trying to
You
connect the
brought
data.
another prop, and I don't
Yes,
know what that
so
means.
After you participate in our survey, people say, pues de qué se trata? What's this about? We say, you know, we can't pay you, but we can give you a token of our appreciation. And so we're giving people sports bottles or water bottles, and they can wash them and fill up with their favorite drink. Yesterday, a man said, you know, is it really for water or can we put other drinks in there? So he was being really funny about
Something healthy.
Something healthy. But this is when we have our surveys after they complete it, we say thank you very much and thank you for participating.
So how many do we want to do? What's the goal?
The goal is 500 surveys.
That's
so
easy.
It seems like a lot, but I think that working together, we can make it happen. And I'm training my students. My students are getting certified in research ethics and research training so that they feel confident in reaching out to our community.
And Dr. Núñez, how long is the survey?
So Mary, our goal is to reach as many seniors between now and Thanksgiving. Because come Thanksgiving, everybody spends time with their family, or they travel, or they have family come in. So our goal is to go in the mornings to the senior centers. And so we're directing people, please try to go to the centers. We'll be there in the mornings, and we'll have different teams of students going out to the center.
And it takes about 10 minutes? or
About
so?
10 minutes
Very
per
good.
survey.
Okay,
We won't
super.
take much time.
And of course, David, give us where they can call. How is it going to be coordinated?
Yes, anybody who is interested on any information about the program and about the senior centers, they can call 915-212-1732.
Very good.
And then they can connect it directly to the particular senior center. So we have 11 senior centers, and they can call to the ones that are close to them.
And I just did want to mention again, because somebody may have just tuned in, and we've been talking about this initiative.
Yes, it's a transportation initiative. We're doing surveys of senior adults in El Paso. We want to collect 500 testimonies, narratives of your mobility needs, and we will have students develop an app for our seniors in El Paso to help you move around the city much faster and hopefully more economically.
And you're working through the Department of Transportation, and only New York and El Paso. So
Yes.
we're going to have to really work hard to get this app in the hands of our seniors.
And the
Thank you so
Department
much.
of Computer Science and Engineering and Sociology and Anthropology and Women's
And Parks
Studies.
and Rec and Senior Adult Program and a whole bunch of partners. So you be sure and call.
Thank you very much.
We'll be back with more guests. With Thanksgiving coming, we certainly want to eat healthy. We want to maintain our normal, schedule for eating because of the tempting holiday season meals. And so we've invited Claudia Rodriguez, who is going to give us some tips, and she does this for a living. She's an advisor. Thank you for being with us.
Thank you, Mary. Thank
What
you
is
for
your
having me.
title?
I am a health and nutrition advisor.
Okay, and so you're going to share with us some factors that contribute to why our health habits get interrupted. I guess they get off track during the holidays with Thanksgiving coming on and Christmas and we get invited to so many places. to celebrate.
Yes. And that's actually one of the things. There's people, we have family members coming from out of town, we have office parties, we have more gatherings, and all of this makes it very tempting to eat whatever is available, which is not necessarily the healthiest of options. And also the holiday season is actually pretty stressful, even though we enjoy it and we like the holidays. It's also a time of more stress, and more stress sometimes makes us go for foods that are not necessarily healthy.
And one of the mistakes that we make is that, okay, I'll worry about that with my New Year's resolution, right? I'll lose weight, but right now I'm going to enjoy and eat everything in sight.
That's true. I'll deal with it in January. And so January comes and we're 15 pounds more than we were before the holidays. And so that's why I'm here to share some of the things we can do so that we can enjoy the holidays, not deprive ourselves, but at the same time be mindful of our health.
Yes, very, very good. Start giving us some tips, because I certainly will need them.
Actually, the holiday season is a great time to stay active. So with all these parties and with all these events, it's a great time to walk, to go to events, to stay active. And that is so important, not only for our physical health, but also for our mental health.
Yes.
And another thing that I would recommend is shop early. We need to shop as early as possible, because the closer it gets to Christmas, the more stressed we are. So
And
the
we eat
earlier
more?
and we eat more. It causes us to eat more, and I see people the 23rd of December shopping, and everybody is so stressed out. So we can avoid that and stay healthier by shopping early.
Yes. Now, what do we do when we have situations where got to go to mother-in-law's house, got to go to my mom's house? Your neighbors bring you pie because they had an extra one that they wanted to give you for Christmas. How do you manage those many meals or big meals in the same day, especially Thanksgiving or Christmas?
Food is a social event, right? Food has become a way in which we interact, in which we connect, and we don't want to offend anybody. We don't want to say, no, I'm not going to eat here because I'm going to eat somewhere else later. We just want to have a little bit of everything. So let's not, I invite all of us to enjoy it and actually eat, but just portion control. Eat a little bit here, eat a little bit there, and make everybody happy
So
by enjoying their
get
food.
small plates and just a taster of everything. That way you satisfy a craving, because there's cravings, during the holidays for the wonderful food that we serve that once a year,
Right, and we should be able to enjoy it. And the problem, I think, is not what we eat, is how much we eat of it. And so I would recommend eat a little bit of everything, wait about 5 or 10 minutes so that our stomach can send the signal to the brain to see if we're satisfied or not. And if we're still hungry, then we should have seconds, because it doesn't happen every day. Holidays only come once a year, but it's about avoiding the overeating.
Yes, and sometimes you have drinks. Of course, your normal drink, water with lemon, or your special hot toddies and things like that. Fruit drinks. How should we drink our drink during the meal?
Actually, having a drink during the meal, I don't recommend it, because it's going to dilute our acid in our stomach, and it avoids having proper digestion. So I would recommend either drinking half an hour before or half an hour after we had our meal. And if we absolutely have to drink something, I would recommend water with a little bit of lemon.
Okay, instead of a sweet drink or something.
Yes.
Of course, I'm not going to talk about the other kind of happy drinks, holiday drinks, but definitely we want to. Sometimes we say, okay, I'm going to go have my holiday meal at noon, so I'm not going to eat breakfast, or I'm going to go to evening for a big party, so I'm not going to eat lunch. Is that good?
No, that is actually one of the ways in which we overeat and we give in to more cravings. So we never want to skip a meal. We want to keep our blood sugar stable so that our mood, our energy, and everything is in its place. Even if we have to have a small breakfast or a small lunch, that is fine. But we just don't want to deprive our body of food for long periods of time.
Yes, and there's so much diabetes, and we have to watch it.
Yes.
During this season. Any other thing that you can share with us that I haven't asked you about satisfying cravings?
Another thing that I would recommend is to reduce stress is to reach out and ask for help, because sometimes we are overbooked, where we stretch ourselves way too much, and that leads us to overeating to giving into cravings to say, oh, well, I deserve to eat this whole pie because I had a very tough time last night. And we don't want to do that. We want to reach out to our family members for help if we're stressed about shopping, if we're stressed about a party that we're hosting. Just reach out and ask for help.
Yes, that's a very good idea. And sometimes sharing a pie, you know, with your friend or your husband, say, okay, I'll eat half and you eat half. That way you don't eat the whole slice. And yet you get that taste, that pumpkin pie or that special cherry whatever. And so, you know, that's really important for us to kind of share with everybody, say, you take half and I'll take half. And that kind of helps a little bit because it's sharing and you're not overeating.
Exactly.
Wow.
I love that.
Yeah.
I'll do that.
Yeah. And your phone number?
My phone number is 915-321-1286.
Great. And I guess that's it. We're ready for the holidays. And we hope you're get ready for the holidays. As Claudia said, shop early, okay? Avoid stress. And we'll see you all next week.